Hi, everyone, and welcome to the Gut Reset Summit. I'm your host, Dr. John Dempster, and today I am joined by an old friend and colleague, Dr. Ryan Wohlfert. Dr. Wohlfert is a certified chiropractic sports physician and certified chiropractic biophysics physician, using a specific protocol for spinal and postural correction to break free from chronic pain, disease, and organ dysfunction. He's also certified mindset specialist, helping people retrain the mind-body connection for optimal health and performance. And with over 20 years of education and clinical experience, Dr. Wohlfert has helped thousands correct their mind and spine to break free from chronic pain, eliminate dependence on a very broken system, and to make simple, pain-free living possible. Ryan, great to see you again. As always, it's been a while, but great to have you on the Gut Reset Summit today.
I appreciate you having me on here because I love bridging that gap between the spine and the rest of our overall health, especially as it concerns with the gut.
Well, we're going to get into all that, and we have a great, lineup of a discussion today surrounding that. We're going to talk all about how spinal correction resets gut health, and we're going to hear a lot about some of the protocols that you've been finding helpful. But I know we go way back, and I just love everyone to hear a little bit more of the journey you've been on, and how did you arrive to this point? How did you arrive to doing what you do today?
It's definitely been a journey, that's for sure. And I started off in spinal health, my own spinal health, way back 35 years ago when I first started going to a chiropractor because of migraine headaches. And I've learned a lot since then, especially what we're going to be getting into today. Because when again, 35 years ago, when I went, again, I didn't know much about it. I was 13 years old. I started getting migraine headaches and numbness, tingling, and there was somebody at my high school office, the secretary, who said, "You know what? It doesn't sound like it's anything wrong, physically, or I can't give you any drugs or it's Tylenol or ibuprofen, but it sounds like maybe there's a nerve problem or you got a pinched nerve. You should go see my chiropractor." Again, I didn't know what the heck that was at the time. My mom didn't even know, but she was open to it. So she took me. I remember getting my x-rays done, and later that day going back, and the doctor going over my spinal x-rays with me and saying, "That right there, your head's on crooked." I don't know. I just remember him saying that. Obviously, it's a memorable point. And then went through a series of adjustments, and all through my life, I've been getting adjusted. I've been going to the chiropractor. Obviously, it wasn't right then that I decided, okay, this is what I'm going to go into. But what was interesting is, my migraines got better, my immune system improved because I was, as a kid, I was sick a lot. Colds every probably 4 times a year. I remember I would get bladder infections as a little boy, which is very uncommon. So again, right there, looking back, I saw that my immune system was not functioning. But as I started addressing my spinal health, just getting adjusted, and again, I was always an active kid, nutrition was okay. Um, my body was starting to heal in other ways other than just headaches and pain and migraines. And that's one of the things I noticed, like putting those pieces together. But what we're going to talk about even later on today is, as I was going through my life, as I was going through school, um, you know, graduating, going to more school, more certifications, having, starting a business, starting a family, the stress, as you know, adds up physically, emotionally, chemically in our world. And my body wasn't strong enough to fight that off, even though I was, taking care of my spine to what I knew how to do. But what I was missing was this structural correction piece that we're going to, again, get into. And it's very similar to how, again, we can go to the dentist and they can clean our teeth and we can brush our teeth, but it's not going to fix the structure of the mouth and the teeth. There has to be a specialized form of dentistry or orthodontist that helps to do that. And that's what we do with the spine, and something that I found about 15 years ago. I didn't found it, but again, following this protocol that I've been able to show thousands of other people how to use.
Yeah, I love the story. Again, it's been a minute since we've caught up, but it's so great to hear your journey again, and it resonates probably with a lot of people tuning into this today. But one of the things that I often get, when I start talking about the spine connection to other organs, is what does that have to do with something that's not your spine? What does it have to do, for example, for today? How is it connected to our gut? So, can you shed a little bit of light on that?
Absolutely. So let's start off with this and just kind of putting these pieces all together, because 2/3, like right now, 2/3 of our population have the distorted spinal structure, spinal posture that leads to chronic issues. And we're talking chronic pain, but also disability, accelerated aging, fatigue and low energy, arthritis, and even increased medication use. Plus, I mean, there's been multiple studies showing how this distorted structure of our spine is an increased risk of death from heart disease, pulmonary issues, and from all causes. So this includes, like, it has a stress on our gut, on our inside, and we'll get into ways that does that. And the reason this is become so serious is because with our society and our world, in these increasingly prolonged forward flexed postures, I mean, just think about as you go throughout your daily life, sitting at the computer like we are doing right now, or
Trying to
on the
stretch my
couch.
back out, Dr. Ryan,
Right?
as we're
Yeah.
speaking here.
We're driving. We're lying on propped up on 2 or 3 pillows. We're in most commonly, right here, we're on these devices here, these phones, and we're living on them. We're not just on them for short periods of time. And typically, what do? We're in that hunched over forward flex posture, which is contributing to this weakened abnormal spine, or I'm sorry, creating this abnormal spine. And as I alluded to with my journey, just like drugs and surgery, a few adjustments here and there, even some general exercises, even like sometimes, okay, sitting up straight, it's not going to fix the alignment. It's not going to correct the posture. It's not going to fix the problem. And the reason this affects our overall health is because of what's inside of the spine, right? Our spine is the foundation of strength, health, mobility, because it protects the nervous system. It protects our nervous system, which has its hands in every single cell, tissue, and organ, including our gut, that we have in our body. So if there's something physically and biomechanically wrong with our posture, our spinal health, spinal structure, that's going to have an effect on our nervous system, on our nerves, which is delivering these life-giving messages to our organs. So that's how this is directly related to our gut health, our liver health. I mean, this is the Gut Reset Summit, so obviously we're going to focus on that. But even if it affects your heart, if it affects your lungs, if it affects your immune system, which, again, as we learn, which I'm sure people are talking about on this summit, and you've talked about, what is it, 80% of the immune system right now is in the gut?
Yeah, give or
So
take.
that is affecting that. And the last thing I'll say right now is, with this distorted spinal structure, it puts a lot of stress and basically activates the sympathetic nervous system, which puts us into a state of more stress. And then we don't have the resources for our body to actually heal our gut, our immune system, our metabolism. And we have all these other sorts of issues coming up because of that we're not addressing, because nobody's really talking about it. So I appreciate you having me on here to address it.
No, this is huge because, a lot of times when we're dealing with gas, bloating, IBS, whatever the gut diagnosis might be, we get the blinders on and we look directly at the gut. We have to take that step back and we have to say, all right, like as you're speaking today, are there any other neurological connections here? Are there any other issues that might be caused by a spinal issue and a spinal, you can get into some of the diagnoses that you see, but any issues there that trigger those nerve roots that travel all the way down and impact organ systems, like the gut is a collective organ system of a whole bunch of different organs, right? So we've got to make sure that we're looking at not only biochemistry, which a lot of us as functional medicine doctors really dwell on, is the biochemistry. It's the foods, it's the diet, it's the microbiome, it's the hormones, it's the nutrients, it's the toxins. But we cannot ignore the anatomy. We cannot ignore the physical structure. So what is a normal spine supposed to look like? Tell us, like
I
what?
just want to, yeah, absolutely. I just want to add one thing to that you made me think of about like the getting the blinders on. And because when we see patients in our brick and mortar office, or when I talk to, clients or potential clients online, it's taking the blinders off. And especially there was this one patient just last week mentioning how, again, she was coming in for, pain, chronic pain, that, she has an increased forward flex posture, scoliosis, been seeing other natural healthcare practitioners and other doctors. And one thing she mentioned last week, because she's a couple months into her program, she was surprised to see how her gut issues have improved, like the bloating that, like you had mentioned, that she had, and how now she's, again, just able to, like, just something as a like a good side effect, right, that she noticed from helping, her spinal health. But yeah, I love that connection, and I love seeing those. Obviously, I love helping people get out of their chronic pain, but also seeing the wide-reaching, far-reaching effects that it has. And so let's go back to that question here. What does a normal, healthy spine look like? So when we're looking at the spine from the front or back, but we want it straight up and down. And this, so let me go back to posture and the spine, because your posture is a window to the spine and nervous system. So anywhere that your posture is distorted off of its ideal and normal shape means that increased stress on the nervous system. Could be damaged, could be injured. It's not always the most accurate. The most accurate way to address the spinal structure is through standing spinal x-rays, because we can see inside. Just like taking your car to a mechanic, they can probably hear how the car is running, but unless they get under the hood or underneath, they're not going to know for sure how it is, or hook it up to the the electrical, doing the code tests, whatever they do with that. But for these purposes, for our posture and our spine, if we look at our external posture, we want the head over the trunk, over the pelvis, right between the feet. If you have your feet about shoulder width apart, or I even say hip width apart, straight ahead. We don't want any deviations to the side, because that, again, tells of, okay, there's a weakening of the spine somewhere. Again, x-rays pinpoint it right where it is. From the side, same thing externally. We want the ear, okay, like the points, ear over the shoulder, over the hip, over the ankle bone. And generally what we do is we go from the floor up, or the ground up. But for these purposes, I'll describe it that way. And if we deviate, again, the more you deviate from the normal, just like blood pressure, the spine has a normal shape. And it is specific to the person as well, in the respect of the side posture, the side view of the spine, because again, I'm getting deep into the weeds with this. So let me tone it down a little bit.
You go. No, this is good.
From the side, we want to have 3 equal balanced curves. And like I said, from the front, we want it straight up and down like a column, like a tower, nice and strong and solid, to provide that foundation. We don't want any deviations to the side, because that's called a scoliosis in translations. But now what we'll talk a lot about here is, I mentioned that forward flexed posture that 2/3 of our world is in, that hunchback, we'll call it. It's called a hyperkyphosis. And normally we want a 40-degree curve in the neck, 40-degree curve in the mid-back, and 40-degree curve in the low back. And they balance each other out, balanced against gravity. But unfortunately, our world is getting outside of that range. And the reason that's so important, that spinal alignment, that spinal structure, is one, it absorbs shock. All right. It absorbs from our walking, our running, our moving, our bending. It puts us in a shock absorbing position. It can withstand that compression. Because when we lose the curve, now it's just man, it doesn't absorb. Think about a spring. It's got a bunch of curves to it and it absorbs. It's the same thing with the spine. It also, so many people are, think they have a muscle problem, which again, muscles are involved. And a lot of times they feel the muscle tightness, they feel the muscle tension, they feel the muscle weakness. But here's the thing, the spine provides attachment points for these muscles. So if the spine is not in this ideal alignment, well, now it's going to create different leverage and it's going to affect the efficiency with which we move. It's at rest now, these muscles are going to be tight and tense. So we can massage all we want, but unless we're correcting where these muscles are attaching to in the position that they're in, they're going to stay tight. They're going to stay tense. So it provides more efficient movement in this ideal posture, an ideal spinal alignment. So now your body's not having to, waste resources on just fighting gravity. Now it's there for, to heal your immune system, to heal your metabolism, to heal your gut, to heal these other issues that are going on instead of using these resources that, that is using just, again, to help us in space and making sure that we're staying upright and erect, which that's the next thing that the posture does too, is it keeps us upright and erect. It is sitting up straight, but also the spine provides that ability to do that. Now, this next one, and this is, again, directly relates to this summit, is it supports our internal organs, both biomechanically and neurologically. We've talked about that already, is neurologically, it has to, inside the spine is the spinal cord, which is an extension of the brain. So physically, the spinal cord is getting stretched because our posture, because our spinal structure is deviated. Well, now, again, it's not going to deliver those life-giving messages to the organs. And they're going to be like, what do I do? And then the organs can't deliver that message back up. So it's like this harmonious communication. So it does that. And then lastly, and this kind of goes into this last part, which we've talked about and I mentioned is, and I think it's the most important thing, is in this ideal position, the spinal cord is relaxed because it protects the spinal cord. So think about a big fire hose. All right. That's what it's like in this normal posture with balanced curves from the side and straight to, from the front to back, you're straight up and down. These balanced curves allow the spinal cord to be relaxed, this big fat fire hose delivering all that information to the body and then back up. When we get, in research has shown this in different studies, in even cadavers, when you lose those curves, it stretches the spinal cord. So think about a rubber band getting stretched. Now it's tense, it's tight, it's thinner in diameter, and it decreases the function of what we can get to the rest of our body, our organs and muscles, tissues, cells, and allow our body to heal. So that's a long answer to one, why, what is it supposed to look like? And two, I want to give background on why it's so important because, as I say it, I feel like the people listening, it makes sense, right? Obviously, right? But that doesn't mean we're going to do anything about it. But if we know the why, it helps for people to take action and do something about it.
Yeah, thanks for the breakdown because I think we take our spines for granted. And, especially today, as you are saying, we're moving into this hyperkyphotic state. I guess, I really want to nail down, do we have to be in pain to know that there's a problem in our spine? Right? That could be impacting our gut, that could be impacting other organs. I guess the answer is probably no. You don't have to be in pain to create all these issues. So many of us were motivated by pain and pleasure. And if we don't have pain, well, okay, I guess everything's working fine there. So we don't really pay attention to as we are shifting and getting out of alignment. So I just, thank you for the detailed explanation. But I just want to make sure that we nail down that you don't have to be in pain to have an issue with your spine that could be impacting everything that you're trying to improve in your health and wellness.
You got that exactly right.
Yeah. So listen, 2/3 of us have a problem apparently. So what do we do? How do we start to fix this? I know you've got a very powerful protocol that you do with your patients and that you're spreading the message, globally right now. Tell us a little bit more. What are some salient points? What are some key strategies that people can do? Obviously, seeing a chiropractor such as yourself and who's trained in this technique, but what can we do from home?
Great question. And that's what I want to get out there to people, because what does a corrective, basically spinal care plan look like, right?
Mhm.
And without the benefit of having spinal x-rays, okay, what can you do at home to know what does your posture look like? So that's the first step. Is we already talked a little bit about assessment by what is a spine supposed to look like, or a healthy spine, by looking at our posture. So very simply, let's assess first. Everybody at home, you can do this by looking in a mirror, like a full length mirror, first of all, looking at your posture from the front. Is anything deviated from the side? Is your, again, use these points of your nose, like right between your nose, between your, well, actually eyebrows, middle of your chest, middle of your like belly button area, and middle of your pelvis. Is that lined up? Like a
Mhm.
plumb line. Is that lined up? And then from the side is your ear, over your shoulder, over your hip, over your ankle. Now that's a little bit harder to see, but guess what? That's the benefit of these little devices that we have, is we can take a picture of us, or you can have somebody look at you too. But you can take a picture of the side and see how that is. Now, based on what you find there, okay, is one shoulder higher than the other? Or let's actually stick to just this hyperkyphotic posture. Is your head forward? Is your back rounded? Are your hips, translated or shifted forward of your feet? So what we call this protocol is EAT, EAT. So it's a little bit different than the nutrition part of the EAT, but it stands for exercise, adjust, and traction. So I'll go over each of those. So exercise means both general spinal exercises and specific corrective postural exercises. So general exercise of your spine, what you can do every day, just like we brush our teeth and we have dental hygiene, we can have spinal hygiene, which takes 2 minutes a day. And a good friend of mine, Dr. Tabor Smith, talks a lot about this, and I want to give just him credit for that, because it's very simple. You can basically, your spine moves in like these different ranges of motion. And so every day, what you can do is bend your spine side to side. And you can either do this reps, or you can, hold for 10 seconds, side to side. Same thing. And think about your head and neck too. Taking your spine in these pain-free ranges of motion. Tightness is a little different, but we don't want sharp pains, anything like that. We don't want a pain response. So if you feel pain going too far with any of these that I'm about to show you, one, discontinue, or two, don't go that far into the range of motion. Stay in a pain-free range of motion. So we got, remember, side to side, this is called lateral flexion. We also have
How often should you do
flexion.
that, and how long should you do that for?
So great question. You once to twice a day. You can either do 10 reps to each side, nice and easy, or you can hold it for 10 to 20 seconds
Okay.
in that position. I like doing reps. It's just again how I just like doing reps, but I know you can just hold it there in that position for 10 to 15, 10 to 20 seconds. So goes for all of them. Then we have flexion, extension. So our spine can flex, which we know we're caught in. And flexion is not bad. It's just we're in these prolonged flex postures on
Right.
these, our devices. That doesn't mean I don't want you taking it in that range of motion, but in general, most people need more extension. So we're talking from your low back all the way up to your neck. Same thing. You can do 10 reps of each, or hold for 10 seconds. And a lot of people listening might be familiar with that camel stretch where you're on your hands and knees. That would be beneficial too, where you're taking your chin towards your chest, rounding your back up, arching back, again, for reps or time. And then the last motion, again, we have rotation. Our body can rotate, our spine can rotate. So you're either sitting or standing, pain-free range of motion, 10 reps each way, or hold for hold that spot for 10 to 20 seconds. And what that does, it allows the spine to get the motion into it. Because when we lose motion, which again, another friend of mine, Dr. Yoni Witten, talks about, when we lose the motion, that's where this chronic pain sets in too. So that's general exercise that, again, I'm confident that people can do on here. Now, based off of your posture, and again, if you have x-rays, but we'll say your postural assessment, if you're shifted one way or the other, or if you find that you have this slump posture. So what we do is these corrective postural exercises, we go in the opposite direction. Okay. And so, and it's based right, just like that, where we're bringing the shoulders back, chest up and forward. So if we're, again, I'll turn to the side, hopefully everybody can hear me. If we're like this, well, now we want to reinforce this. You're going to take it in this posture, hold for 5 to 10 seconds and relax. 5 to 10 seconds and relax. 5 to 10 seconds and relax. And we call these mirror image exercises because we go in the opposite direction as the spinal distortion. This is from chiropractic biophysics, CBP for short. This is the protocol that we use. And we have to retrain not just the muscles, well, we'll get to the ligaments in a second, but this helps to retrain the muscles in the healthier position. And last point about this, just like I don't want you to walk around in this position, in a slumped position, this isn't meant to get you to where you're walking around completely opposite. Just like we train muscles in the gym past the normal physiological, point to get them to grow larger. At least I try to do that when I'm in the gym. It's not like, unfortunately, in that case, that's not like my muscle stays in that pumped up position in that. We take it to the opposite, so then it ends back up in a healthier posture. So that's the E part of it. That's the exercise.
Got it. I love it.
Okay.
Keep going. You're on.
So here, I'll keep going. So the A stands for adjust. And as a chiropractor, that we give adjustments. That helps to, but this also, I've adapted this to adjusting your lifestyle, which I'll get to here. But the adjustment performed by a chiropractor, by a trained, physician who can do that, is it activates and stimulates the nervous system, plain and simple. It's like it's like giving a dead battery a charge. But unless we're getting a new battery in that case, or correcting the spinal structure in this case, which we'll get into with the T, it has a short-term effect. And I want to help people have a long-term sustainable effect. So the adjustment by hands-on by a chiropractor, or what also includes adjust your lifestyle. So how am I bending? How am I sitting? How am I standing? How am I moving, walking, sleeping? What is my posture like while I'm doing these activities of daily living? And if we're not adjusting our lifestyle, and this could also include nutrition, also include exercise, our sleep habits, everything there, but posturally, am I slumped over my Chrome, my laptop, my computer, my phone for hours on end? Am I playing solitaire on my iPad, sitting in a lazy boy chair or whatever game, or even reading a book, and not in this strong posture? It's going to reinforce the poor, distorted posture. So it's adjusting your lifestyle, taking inventory of that, making sure that the ergonomics is, again, nice and aligned. Okay. The last part, and I want to leave time for this because this is actually the most important part of the corrective process, is traction. And don't get images of torture devices. I don't even want to say that word because, but yeah, so traction is like putting braces on teeth. That's the best analogy that I found. When your spine gets distorted and it's in this posture for a long period of time, well, now the ligaments that are holding the bones together, the vertebrae together, they get fibrotic, they get sclerotic. arthritis, ligaments break down, cartilage breaks down, and it gets stuck. So think about, if you ever broken a bone and you're put in a cast, all right? So let's say you break your arm and you're in a cast and the elbow is bent. After 6 to 8 weeks, you take the cast off. Are you able to freely move that? No, the ligaments get taut and so do the muscles. So we have to retrain them in the right position. We have to actually take them past what they're used to. And that's what the traction does. Now, at home, again, this is a very specific, I call it supportive traction. If you haven't had x-rays done to know what is specific to you, a general supportive traction exercise, I guess you could call it, or modality is rolling up towels, rolling up 2 towels, one for your neck, one for your low back. So when you're laying on your back, you put one of them underneath your neck and you put another one underneath your low back. And you can start at 3 to 5 minutes and increase it a couple minutes each day till you're laying on those for 20 to 30 minutes, because that's how long it takes for the ligaments to start to remold in the healthier, stronger position. I mean, I'll say this, there are more specific home rehab devices that we use, and also in office machines that we use to help people hold that position. And obviously that accelerates the healing, but this is something that people can do at home. It's called spinal remodeling using towels, or towel spinal remodeling. But I would definitely encourage you and highly encourage you to find, if not me, then somebody who's certified in CBP to help you out with this process and going to see them. And if you ever need help with that, I can help people find somebody in their area. And if not, we can figure something out.
Powerful. You triggered me earlier there. As you were talking about ergonomics, what's your thoughts on the standing desk rage right now that's out there?
I have one right here. I'm actually sitting down for this. I normally, for interviews, I sit down, but when I'm working, I'm standing up. It's just, I found when I stand during an interview, I'm moving around way too much, and I'm like, all right, just stay right here. But no, just like standing too much, or I should say all the time, it can put a stress on it. But while I'm standing, I'm doing stretches. So this is even part of adjusting the lifestyle part. Is I'm like doing like a fencer's stretch, or a lunge type stretch, where one leg is back, one leg is to the side. At my brick and mortar office, the computers are lower. It's not on a standing desk, that we use when we're treating patients to put our notes in. I'm taller than most of my staff and the people who work there. So it's, we want our computer, the top of the computer screen, about eye level, right here, like the top, third of it. But, it's down chest level for, at the office. So I'll spread my legs apart, and lower my height. So again, I'm getting like some stretching in, like a side stretch there, lunge stretch. And, patients are like, why are you doing that? I'm like,
Dr. Ryan, that's got to be quite the sight, coming in.
Yeah. And even when I'm adjusting patients, the tables that we have, they rise up and down. I keep them down because I practice movement while I'm doing it. So I'm like lunging to the side and doing like a side squat as I'm treating them, as I'm working on their low back. Again, I'm in the fencer stance, keeping track of my posture. I'm not perfect at it. Trust me, there's times where I'm working at my standing desk here and I'm like that, but it's being aware of it. It's being okay. And, that's a huge part of it. That's another A, I guess, is having the awareness to know when you're in these position and to correct it. And I am the posture police at work. That's for sure.
Well, I think we all need it. I mean, geez, as soon as we started speaking, I was like, oh, yeah, there we go. Got to get back into that motion. But it's easy to slip out of that. Good reminders. And, that's a great protocol you've got. The EAT, acronym is helpful. What else can people be doing, if at all, that, it can be benefiting not only their spine, but their gut health when they work with this type of protocol?
So remember, and I should have mentioned this or really hit it home, but I think you did a great job of it. Is, I talk a lot about the spine, but when I talk about the spine, especially as it relates to gut and organ health, it's because of the effects that it has on that.
Hmm.
So just don't think of, okay, I'm working on my spine to work on my spine. I'm working on my spine to help my overall health, to help my metabolism, to help my gut actually function. So, I mean, what else can they work on is, we kind of touched there, is the awareness of it. Why are you doing what you're doing? And that goes into the almost the mindset part of health. Being a certified mindset specialist and going through the training of that, that's honestly, maybe the biggest portion of this, because unless you have the mindset, not the positive thinking, it's not that. But if you see yourself as somebody who's always got a gut issue, I'm always constipated, I'm always get diarrhea, I always have bloating, you're probably always going to have it because you're going to go back to that identity of somebody who has gut issues. And I know we're getting off the rails with that a little bit, but that's such, and you ask what else can people do, is
Hmm.
work on their mindset around the words that they're using for their health, for their gut health. Do you feel like you're stuck in this paradigm? Do you feel like you're stuck and there's nothing else you can do? You've tried everything. Well, guess what? If you haven't addressed the spinal structure, you haven't tried everything. And I'm not just talking about, okay, I see a chiropractor once a month, or I've never had spinal x-rays and I was going and get adjusted. That's not really addressing it to the
Hmm.
fullest degree, because one of our specialties is helping people who've been to other doctors and chiropractors that have looked at their spine, but not to the thoroughness that we have.
Hmm.
So I hope that answers your question in that regard, because we could talk for another hour or more about what else people can do, but I don't like giving them too many things to do. If they work on those exercises, the spinal range of motion exercises, assess what their posture's like and work on those, that's a great start in evaluating the ergonomics or their lifestyle to make sure that they're in a healthy spinal alignment, at least as they're going through their daily life.
Those are powerful. And, Dr. Ryan, I do want to come back to your mindset because I know how much of an expert you are on this. If there was one maybe affirmation or one sort of sentence that people should be thinking of, it's very hard to nail it down to one. And I don't mean to put you on the spot, but is there something that people can start doing today? Because we talk a lot about this in the summit, is the mind body, the mind gut connection. And we do believe that, so that it's important to heal by improving, mental health and belief systems and clearing out obstacles that way. So please tell us this something really quickly. I know we can't surmise it all down to one sentence.
The biggest strategy or solution or drill that you can do, especially as it relates to mindset, is count your wins. And by that I mean it's not positive thinking. It's not I'm going to get better, I'm going to get this and that, because if your brain doesn't believe it, it's going to create this cognitive dissonance where, again, it's going to backfire and go on the opposite. Count your wins is actually finding the evidence throughout your day, every 24 hours. Go throughout your day, and if your goal is to, reset your gut, whatever that means to them, like to not be constipated or, again, bloated every time I have this certain food, or to be able to do this or that, because of what that does. Okay, I can't go on vacation because my gut, I don't know what's going to happen. I can't travel. So if your goal, that's a great one. If your goal is to travel, find the evidence of things that you're doing every day, working with your functional medicine doctor, working with your chiropractor, working on your own, learning something that led you towards being able to travel into, because you've been able to heal your gut. And I'm talking little things. So let's say you haven't been able to eat greens for some reason. And now, okay, or let's say you hate greens. I hate eating green vegetables. But today you had one piece of broccoli. Don't beat yourself up because you didn't have a big bowl of broccoli or a big salad. reward yourself. I don't mean with food, but with that, counting the win. Count the win of what you did instead of what you didn't, and then measure your progress backwards. If that makes sense. Hopefully that makes sense. Is measure your progress backwards, because that's going to make you feel better about yourself rather than beating yourself up for not getting to that goal yet. Always count backwards, count your wins.
That's fantastic. We do a simple exercise where we actually have them write them down. And
That's what I want them to do. Yes.
yeah, that's great. Thank you, Dr. Ryan, because it's such an important connection, is bringing that mind piece back down to not only the anatomy and the structural piece, but back down to the biochemical piece. It is all connected, and this is a very key conversation that we've had today about connecting some of those other dots. So thank you. Where can we learn more about you online?
Go to drwohlfert.com. I'm sure there'll be a link as part of this summit, but yeah, drwohlfert.com.
And yeah, that's great. I know you've got a lot of resources on your website, and everyone should take advantage of those, and reach out to Dr. Ryan if you need to feel if you feel so inclined. So thank you so much again. This has been very powerful. Thank you for being on the Gut Reset Summit, Dr. Ryan, and I look forward to seeing you in person, hopefully, in the near future.
Yes, sir. Thank you.
Take care.